Good evening, and thank you for participating in the Urban League of Palm Beach County's COVID Flu Telephone Town Hall meeting. We are proud to partner with the T. Leroy Jefferson Medical Society to host this informative event. We have an exciting presentation for you this evening, and our guest speaker is Dr. Katongo Camino, whom I will introduce shortly. Ladies and gentlemen, did you know that the annual COVID and flu shots are now available? Press 1 if yes, press 2 if no. Please remember that if you would like to ask a question, press 0. Again, callers, please press 0 to ask a question at any point throughout the call. Good evening again, ladies and gentlemen. We are so happy that you are joining us for the Urban League of Palm Beach County's COVID Flu Telephone Town Hall meeting. Again, we're proud to partner with T. Leroy Jefferson for this informative event. And please, during the presentation, dial 0 if you have questions. At this time, I would like to introduce our guest speaker, Dr. Katongo Camino. Please remember, dial 0 if you have any questions. Dr. Katongo is the Vice President of T. Leroy Jefferson Medical Society. He is also the CEO of Kelly Medical, LLC, which provides infectious disease consultation to personal and business entities. Dr. Camino is a senior partner with Infectious Disease Consultants, Inc., based in Boynton Beach, Florida, since 2002, and is a member of the T. Leroy Jefferson Medical Society. His expertise is HIV, general infectious diseases, and now the SARS-CoV-2 pandemic. Currently, he is the chairman of the Infection Control of West Hospital, and a long-standing inpatient consulting throughout Palm Beach County, including JFK Medical Center, Wellington Regional Medical Center, Bethesda, East-West Hospitals, and Select Hospitals. Furthermore, he is on air, television, talking about infectious disease consultants and has appeared on WPTV, WPBF, and WPEC. Welcome again, ladies and gentlemen. Dr. Katembo will conduct his presentation. Please remember to press 0 if you have any questions. Welcome, Dr. Katembo.
Yes, good evening. Thank you again, Salon Johnson, and everyone at the Urban League of Palm Beach. T. Leroy Jefferson Medical Society really appreciates this opportunity to talk to you and share information and updates as to where we're going in late 2023 into 2024 with COVID and influenza and RSV. So once again, my name is Dr. Camino, and I like to keep things informal, so please, if anyone has any questions at any time, feel free to raise your hand in the chat, and I'm sure we will get to you as quickly as possible. So what I'll do is, and what I usually do when I have these presentations, is I'll give you an update as to where we are right now, and as far as COVID, as far as influenza and RSV, and then I'll take questions from the audience. So again, thank you very much for this opportunity. The three important things that I remind people right now, and again, for the audience, I am a practicing infectious disease physician. I am actually at this very moment inside one of the hospitals. So the important thing that we as infectious disease doctors are reminding everyone is that, number one, COVID is still with us. COVID is still a pandemic that is still with us, and that even though you may believe that COVID is done with you, COVID has not left us. And so we see even today several cases in several hospitals that are still coming in on a daily basis positive for COVID infection. And for many of you in the audience, you probably know a family member or a friend who's actually had COVID, if not yourself. That's the first thing. The second thing is what we found out after all of this, that everything has been through, is that we have lost over 1.1 million people to COVID here in the United States of America. And we've had a total of over 6 million hospitalizations for people with severe COVID. So that, to me, tells me that if you have a severe case of COVID because you have an underlying medical condition, which we'll talk about, during the last few years, there was a 1 in 6 chance that you would die from this infection. And that is a very sobering thought. And so we tell and inform our patients and our families and our friends all the time that if you are a high-risk individual, and for many people, it doesn't have to be, something like you're a transplant patient or you're on chemotherapy. It means something as simple as, I have high blood pressure, I have diabetes, I'm overweight, I have sickle cell, I'm pregnant. These all put you in a high-risk category. And so if you get severely ill from COVID and you have these high-risk factors, during the last few years, 1 in 6 of those who were admitted actually died. And so we need to keep that in mind about how severe COVID can still be. And then the third thing, and this is really the most important thing that T. Leroy Jefferson Medical Society and others are trying to really empower the audience in Palm Beach County, is that 1 in 6, in some places 1 in 5, people who have had COVID continue to have COVID symptoms beyond the month or 4 weeks since their diagnosis. And this is concerning because, when we're talking about COVID, we're talking about not only, breathing difficulties and shortness of breath and chest pain, but we're talking about brain fog. We're talking about inability to focus. We're talking about inability to work your way through a full day when you go to work because of fatigue. So when you're saying that 1 in 5 or 1 in 6 people who have had COVID end up with what's called long COVID, then this is something that affects our ability to work at our jobs. Furthermore, it affects even our children when they go to school if they were infected with COVID. So this is something that we are seeing as healthcare providers in the community when we see patients who follow up in the office. And they're like, Dr. K, I still don't feel like myself. I had COVID, 6 weeks ago, and I find it difficult to get up and go to work. So it's important to remember that while we believe that COVID is no longer an emergency, it was declared a non-global emergency a few months back, it still has repercussions for those who get COVID, and it can still affect us as we go down the line. So those 3 nuggets, the fact that COVID is very much still with us. We're still seeing people coming into the hospital on a daily basis with COVID. The fact that it is a very lethal infection. Many people have died, as many of us know, family, friends. And then the third thing being that COVID can lead to a chronic condition. It is actually a billable code for those in healthcare. It is a code that you can actually put down when you see a doctor, and he or she can diagnose you with long COVID, meaning you have symptoms that persist for more than a month after being diagnosed. Because for many people, they cannot return to work, and they need to be to put this on their insurance and things like that. So these are the 3 most important points that I wanted to mention just starting off with the presentation. As it comes to specifics, when it comes down to where we are specifically number-wise, our positivity rate for COVID has come down. We are down to about 8% in the U.S. right now. We would prefer to get that positivity rate to be less than 5%. What does that mean? That means if you test 100 people right now, 8 of them will test positive for COVID. So that is still high, and we would prefer to see that number come down. But the hospitalizations, as I indicated, have been going up. And so we have actually seen an increase of almost 10% in the U.S. in COVID cases in the last few weeks. And so this is an issue. And lastly, the deaths from COVID have also gone up about 8% as well in the last few weeks. So the important thing to remember that we are still seeing COVID. People are still coming into the hospital. People are being admitted once they come to the hospital because they have respiratory issues. And some of those people are not making it out of the hospital because of the complications and the deaths that they see from COVID. So that is sort of the backdrop that I wanted to give everyone just as we start going into this conversation. And so I'll take any questions if anyone has any before I can proceed with talking anything further about vaccines and therapies.
Thank you so much, Dr. Camino. Again, callers, please remember, if you have a question, just dial 0. I think what's also important, too, is we do have one question here from, well, let's just say, if the flu vaccine is safe to get, another was wondering if COVID is coming back. I mean, is you said that it's safe to get the COVID vaccination. Is there a preference in terms of that vaccination? What do you suggest, especially if you may have had Johnson & Johnson as opposed to another?
Yes, that's a great question, and we get that a lot. First of all, as far as the flu goes and COVID goes, you can get both of those vaccines simultaneously, meaning on the same day. You can go to CVS, you can go to Walgreens, and you can say, you know what, I need to get that updated COVID vaccine, and I haven't had my influenza. I haven't had my flu shot since last year. So you can get both on the same day. That's okay. If you don't prefer to do that, you don't have to do that. You can certainly space them out. And so the issue which you brought up is very important. We are no longer doing booster COVID shots. Right? Okay. What we have now in our hands is an updated, what's called an updated COVID vaccine 2023-2024 season. And what does that mean? As you guys know, we started with vaccines that were based on the original COVID-19. And then as the COVID-19 mutated into different variants, you've heard about these variants, the most important being the Omicron variant. Right? Once you got the Omicron variant, which was very severe, with a lot of people getting sick, a lot of people dying, we came up with the bivalent COVID-19 boosters. And what that was, and what that basically was, it was supposed to enhance the protection you had from the initial vaccine, but it included the Omicron. But now, what we're talking about is not a booster. We're at the point where we are talking about now a new updated COVID-19 vaccine that covers not only the Omicron, but it covers all the variants that we have to date. And so this is a new updated vaccine. The idea is that everyone, and the reason I say it's not a booster, it's a new updated vaccine, which means that regardless of what you got in the past, whether you got Pfizer, whether you got Moderna, whether you got J&J, you should get an updated vaccine with either Pfizer, Moderna, and you can also have, there's a new one called Novavax. Novavax is not a single one and done. It's a 2-shot regimen where you get a shot now and you repeat in 8 weeks. And so that is what we recommend for everyone as of this very moment.
Okay, then. So we do have a question from Carl from Lake Worth. Does the new booster cover the new variant, -BB6?
Thank you, Carl. That's a great question. So to the point I just made, and Carl is doing his homework. He's keeping track of all the latest variants. The updated COVID-19 vaccine, yes, it does cover the Omicron variants, including specifically the XBB lineage. So, yes, that is covered. And please remember that the idea is that the updated vaccine will cover not only the original strain that we had, but also the Omicron variants. And so this new updated vaccine is what will take us through into the new year, into 2024.
Okay, then. I think Carl is actually, does he have another question, Carl?
Yes, thank you for answering my question. It's just with the new variant, should we be more concerned? Is it more severe than the Omicron variant, or that? How are the symptoms? Are the symptoms more severe?
Again, this is a great question. So, to answer you, we are not seeing more severity as far as when patients are coming into the hospital. A lot of the same symptoms that everyone described within the last few years are the same things we are seeing: shortness of breath, cough, weakness, headache, fever. The very same things that you could associate with influenza or even RSV, which is something we'll talk about later. So the updated COVID-19 vaccine will definitely cover that. What we don't want people to do is not go unprotected. We know that the COVID is still there. We still recommend that everyone keeps up to date with the vaccines, while at the same time maintaining, the same universal precautions that we all should be doing. Washing our hands, making sure that if you are going to get on a plane, or if you're going to go to a crowded indoor event, don't feel bad about wearing a mask. This is something that everyone should still feel comfortable doing. I still do it when I go into Publix, or any of the stores. I mean, it's something that is part of our culture now, and we should all sort of, unfortunately, get used to this being the new normal. That we are going to, like influenza, we are going to probably get into an annual COVID-19 regimen, much like we do the flu, along with everything else that we do to protect ourselves.
Thank you so much, Dr. Camino, and thank you, Camino, for the response, and thank you, Carl, for that awesome question. Callers, please be reminded that if you have a question, please dial 0. Also, if you need information on where to find free COVID shots, if you are uninsured, press 1 for yes and 2 for no, and 3 if not applicable. Again, do you need information on where to find a free COVID shot? If you are uninsured, press 1 for yes, 2 for no, and press 3 if not applicable. So we have another question, Dr. Camino. Who should get the new RSV shot?
Yeah, so unfortunately, we're in the midst of 3 different viral infections. And so let me just start off by saying that COVID is 1, influenza is 2, and RSV is 3. So RSV is a well-known viral infection that affects the respiratory tract much like the other viruses do. And so fortunately, science has again come through and has finally produced 2 vaccines against RSV. There's one by GlaxoSmithKline and there's another one by Pfizer. Both of these have been approved. These are protein vaccines, which means that they are proteins, inactivated proteins that trigger our immune response so that they, when they get injected, our immune system gets activated and protects us against RSV. So right now, to answer the question, those individuals over the age of 60 are recommended for the RSV vaccine, especially if you are immune compromised. And again, that means anything from if you have hypertension, you have diabetes, you have COPD, which a lot of people have, or emphysema, anything that would predispose you to worsening breathing problems, we would recommend it. Matter of fact, even for those who are pregnant beyond 32 weeks, the RSV vaccine has approved. And the reason we do this, the reason why RSV is so important is because it causes severe lung infections, and it can cause pneumonia, and it can affect those elderly in our families, and it can also affect our young children. For those who take care of children or who have been in the hospital, RSV can be a very severe infection in young children, and a lot of people don't know this, but RSV actually kills about 14,000 people a year. So this is another infection that can be taken lightly, and so we would recommend RSV vaccines for anyone over the age of 60, especially if they're high risk. And if you have an individual who's pregnant who is also high risk for whatever reason, we would recommend that for her as well. So that is a very good question about that, because quite frankly, we don't have a treatment option for RSV. They're working on it, but we do not have one. So the best option is to try to prevent it from infecting you by getting the vaccine. So good question.
Wow, thank you. And that really is just for individuals that are 60 plus?
60 plus, and or those who are severely immune compromised. So if you have someone who has severe COPD or emphysema,
Okay.
we may have our uncle who's at home on an oxygen tank, because he was a former smoker, or maybe he was married to a smoker, he or she was married to a smoker. It's people who have especially, pre-existing lung problems, breathing problems that we worry about. And so we specifically are targeting people over 60 because we know that they're a high-risk group. But if you have people under the age of 60 who are high risk, who are oxygen dependent or have severe medical issues, then you can still go ahead and get the vaccine.
Okay then. Thank you so much for that response. Callers, please remember to press 0 if you have any more questions. Dr. Camino is here to answer your questions. Also, I have a question this is more of a survey question is, will you get both your flu and COVID shot this fall? If yes, press 1 let me just say that again. Will you get both your flu and COVID shots this fall? Press 1 for flu only, press 2 for COVID only, and press 3 for both, press 4 for neither. So will you get both your flu and COVID shots this fall? Press 1 for flu shot only, press 2 for COVID only, press 3 if you plan to get both the COVID and flu shot, press 4 if neither. And then remember, please, callers, to press 0 if you have any more questions. Now, we have another question, which is, what about kids? Is the COVID and flu shots, are they safe for kids? What ages? What are the impacts?
That's a great question. We get that a lot as well. So when it comes to COVID, the new updated COVID-19 vaccines from Pfizer, Moderna, are able to be given to children, really infants, starting at 6 months, and they can be given safely. So from 6 months up, our infants need at least a single dose of the new updated COVID-19 vaccine. The same goes for basically our 5 through 11-year-olds as well. They need at least one updated dose of Pfizer or Moderna. Now, 12, once you hit 12 and up, you have another choice. 12 and up, you have a choice of the newly updated Pfizer, Moderna, or the 2-dose Novavax. The 2-dose Novavax.
Okay.
That is a newly approved COVID vaccine, perhaps for those who prefer not to use Pfizer or Moderna for whatever reason. Maybe they use either one of those vaccines, and for whatever reason they did not tolerate it. If you want to try something different, Novavax is not an mRNA vaccine like Pfizer or Moderna. It is a different type of vaccine. So from the ages 12 and up, which includes most of us on this call, I would say, you need at least one updated Pfizer or one updated Moderna or a newly updated 2-dose Novavax, and that is the current recommendations for that. Now, for the flu, yes, as you know, much like we were talking about with COVID, every year we have new updated flu vaccines, right? And so we have what's called a quadrivalent, which basically means they took 4 different strains and made it into this particular vaccine. As everyone knows, the flu vaccine is updated annually. So it's always made to reflect, going back to Carl's question, it's always made to reflect the most recent infections during the past year. So the flu vaccine is safe for children 6 months and up, and the dose is just adjusted according to the child's age. So yes, you can give the flu vaccine to any infant 6 months and up, and it is recommended also for all the adults at this time.
Okay, excellent. So, Dr. Camino, we have 2 questions from our audience. One question from Laura from Wellington. It's COVID-19 shot. Can it be taken at the same time with the flu shot? And I'm going to.
Okay, yeah, that's a great question, and the answer is yes. Yes, you can.
Okay, and Laura is actually is able to speak at this point.
Hi, yes. Well, yeah, that was my question. And then I do have another question, though. How do I know if I'm immunocompromised? I hear that term a lot.
Yes, that's a great question, Ms. Laurel. As we mentioned briefly, for many of us, being immune compromised, it's not a word we're used to hearing, right? But what we found out during the last few years of the pandemic is that certain people ended up in the hospital more so than others. And so it included everything from people who just had diabetes, type 2 diabetes. It included people who had lung conditions like COPD or emphysema. It included people who had high blood pressure. And that already accounts for many people, especially in our communities, which is something that we also need to talk about how COVID has affected the health disparities, have affected how we respond to COVID in our communities. So the things you don't normally would think about that would put you in an immune compromised condition: diabetes, hypertension, COPD. Are you on dialysis? Are you pregnant? Being pregnant actually puts you in a high risk category. We had some really severe COVID cases during the last couple of years of pregnant women because being pregnant actually reduces your immunity briefly. And so if you have asthma, if you're taking medication essentially for almost any condition, it's something that puts you at an elevated risk. And we worry, of course, if you're a cancer patient, of course, if you're an HIV patient, these things, these chronic infections, these obviously put you in high risk as well. But the idea being that if you have a question about your immune status, feel free to reach out to your doctor, and say, hey, I heard Dr. K talking. I need to know if I'm immune compromised because, I'm thinking about getting the vaccines now, or I'm thinking about getting the updated vaccine. So where do I stand with that? So if you're unsure, feel free to reach out to your healthcare provider just to clarify if you are or not. And one of the things that I will say that is often overlooked is obesity. One of the biggest issues we saw earlier on in COVID when we were taking care of people in the hospital, a lot of the people who ended up in the ICU in acute respiratory failure from COVID were people who were dealing with obesity. And so this is one of those very commonly, disregarded diagnoses because technically a lot of us are overweight if you look at the charts, right? But that was a significant factor when you throw in, okay, they have asthma and they're obese and they had COVID. A lot of times those patients did worse. And so we want people to be reminded that, for many of us, we are at high risk, even though you may not think you are.
Thank you so much, Laura, for the question. Thank you, Dr. Macamino. We do have another question from Deborah from Florida. What is the difference between COVID, flu, pneumonia shots, which should be taken with no current health issues? And Deborah is going to join us on the call.
Hello, this is Deborah. I'm calling from Broward County, Florida. So I'm a COVID survivor. I had COVID back in 2021 and even up to 18 days hospitalization. Went through all of the remdesivir and all of the whole program of drugs, but I have been doing fine ever since. So I don't know. I did take the Pfizer. So at this point, I don't know if I should take the flu shot, take the pneumonia shot, get the COVID vaccine again. I'm not sure which way I should go. And I don't have any pre-existing conditions, no problems with breathing or anything like that. And I do have the obesity and type 2 diabetes.
Thank you, Ms. Deborah. I appreciate your honesty. Thank you for giving us your story because you bring up a very important point. Reinfection. So you had COVID, you were hospitalized with it, and thankfully you were able to survive. With people who had COVID previously, we have noticed that one of the characteristics about this particular virus is that it can affect you more than once. And it can affect you more than once in a very serious way, meaning that unlike something like, let's say, shingles, for example, if you have shingles, normally you don't get shingles several times in your lifetime after that. Most people don't. But unfortunately with COVID, the way this virus works is that you can get reinfected more than once. And so I'm glad that you haven't gotten sick since the first time you were sick, Ms. Deborah, but we know that the body does not generate, unfortunately, with this infection, the body does not generate enough antibodies or soldiers to protect you long enough to keep you from getting reinfected in the future, which means that once you've had COVID, even as bad as you did, those antibodies that your body produced to protect you were probably gone out of your system 6 months after you were out of the hospital. So that means that you should continue to do everything you can to stay protected against getting reinfected with COVID in the future. So you did mention that you do have risk factors. And so I would say to you, Ms. Deborah, please get the updated vaccine, be it Pfizer, be it Moderna, or the new Novavax, okay? Because we know for a fact that people can get reinfected. And just to double back on what we talked about with long COVID, we know that the people who get reinfected more than once, the more infected you are, the more frequently you are infected, because we do see people who have had COVID 2-3 times, the higher the risk of developing long COVID, which means that the higher the chance that you are going to have problems with being able to get up and go to work, being able to just function at your job. So I would recommend that even if you've had COVID before, and if you've had COVID within the last 6 months, that's fine. But if it's been more than 6 months since you had your last infection, then you need to get the new COVID vaccine. And that goes also definitely for the flu vaccine. Pretty much everyone, I think, on this call, on this audience, definitely should get the annual flu vaccine as well. But that was a great point. Thank you for sharing that, Ms. Deborah.
Thank you so much for the call. I do want to remind all of our callers, please remember to press 0 if you have any questions. Also, I really want to ask again, will you get both your flu and COVID shots this fall? Press 1 if you're going to do the flu only. Press 2 if you are going to do COVID only. Press 3 if you are going to get both your flu and COVID shots. And then press 4 if you will not get either. So we do have another question from Elsa from West Palm Beach, Dr. Camino. I recently got over the cold. How soon can I get the flu shot following?
Oh, that's a great question. As long as you are asymptomatic, which means that you are over your viral illness, because it is practically wintertime, there are a lot of other viruses traveling around the community right now. But once you're over your illness, no fevers, no cough, no shortness of breath, and you're basically back to your normal state, you can go ahead and get that flu vaccine.
Okay, thank you so much.
Is on the phone.
Thank you so much. I get to understand the question. So thank you so much. I was kind of worried. I recently got over the cold, and I was studying if it's possible that I should go and have the flu shot at that quick moment. So,
well, that's a good point. We always want people to be in their best health possible when they get any vaccine, because as you know, the vaccines can, in many people, temporarily make them a little weak. They have a little pain at the injection site. some people even have a little low-grade fever the day of the vaccine, even though most people don't have any of those reactions. So we really want to make sure that when you're ready to get either the new COVID vaccine or the annual flu vaccine, we want to make sure that you're in your best shape possible. So yeah, that's a great point, and remember the vaccines are there to prevent you from getting ill from the infections, right? So vaccines don't prevent you from getting infected. They prevent you from getting super sick from the infection. So, a lot of times people come up to me and say, Dr. K, you told me to get the vaccine, and I got the vaccine, and then within a month or two, I actually got sick from the flu or from COVID. And I said, okay, well, what happened? Well, I was sick, but within a day or two, I was able to go back to work. I said, okay, well, that's the vaccine at work. Because if you were unvaccinated, especially we see this in COVID, if you're unvaccinated and you come down with COVID, your risks of ending up in the hospital are much higher, much higher. So COVID may not block you from getting a COVID infection, but it'll keep you from getting sick from the COVID infection. And so I always have to remind people, when we're out and about, you can always pick up these infections from people you don't know. But knowing that you have the vaccine in your system will keep you from ending up in the hospital and seeing me hovering over you in a hospital bed.
Okay, thank you.
Thank you so much, Ms. Elsa. I do want to remind you, ladies and gentlemen, please, if you have any questions for Dr. Camino, please dial 0. I also want to ask you again, do you need information on where to find free COVID shots if you are uninsured? If so, press 1 for yes, 2 for no, and 3 for not applicable. Again, the question is, do you need information on where to find a free COVID shot if you are uninsured? Press 1 for yes, 2 for no, and 3 for not applicable. Okay, so we do have another question. What is the difference between the flu vax and the pneumonia vax?
Okay, so the flu vax is what we're talking about here today. It's the influenza vaccine that is updated every year that basically prevents you from getting super sick from influenza A or influenza B. Pneumovax is a vaccine that is not given every year, but it's a vaccine that is specifically targeted for bacterial pneumonia. So remember, flu vaccine is for the virus influenza. The Pneumovax is a vaccine that is made to target bacterial pneumonia, specifically strep pneumonia. So strep pneumonia remains the number one cause of bacterial pneumonia in the USA. And strep pneumonia is basically what we call walking pneumonia. It's the type of pneumonia where your symptoms are very similar to the flu, except that you come in and many times you can have a lot of worsening complications from the strep pneumonia. You can end up on a ventilator. You can end up with a blood infection. You can end up with very severe complications. And so we worry about people, again, 60 or 65 and over, who are high risk, who could end up in the hospital with bacterial pneumonia. And so we always recommend Pneumovax, which is a vaccine against strep pneumonia for individuals over the age of 60, whereas influenza is a viral infection that usually doesn't make people as sick in the sense that you don't end up in the hospital, although last year we had 20,000 deaths from influenza in the USA. So influenza can still be lethal, but the important thing is it can affect everyone, from your babies to your teenagers, to you, to your parents, your grandparents, and so it's the kind of thing that we always recommend an influenza vaccine for. And please remember this too, we're not talking about a pandemic of influenza. The last time we had an influenza pandemic was in 1914 and 1915, around that time. So keep that in perspective, we don't have an influenza pandemic, yet we recommend an annual flu shot because it's that important. Meanwhile, we have a COVID pandemic. I mean, that has killed millions, and that is the reason why we definitely want to recommend an updated COVID-19 vaccine, right? So if we're going to do this for the flu, we definitely need to do this for COVID. And so that's what's important for people to go in and get that shot. And if I may, Ms. Johnson, I'm just going to jump in here because you brought up a good point before I forget. I actually called Walgreens yesterday because a patient of mine who has no insurance wanted to get the COVID vaccine, and Walgreens said that they would honor that. So the commercial pharmacies will honor uninsured or underinsured patients if you want the COVID-19 vaccine. Okay?
Okay. Yeah, that's excellent because that is one of the most important things, and that was definitely one of our survey questions. If you are uninsured, we really want to be able to identify how to assist you. Again, callers, please press 0 if you have a question for Dr. Camino, as we are almost coming close to the end of this wonderful town hall meeting. I do want to remind you that, here's another question is, did you know that the annual COVID and flu shots are now available? If you press 1, if yes, and 2, if no. Again, to our callers, did you know that the annual COVID and flu shots are now available? Please press 1 if yes and press 2 if no. Just want to ensure that everyone is aware. Now, I have one more question. Again, it keeps coming up is, why do I need to get a COVID shot if I already have COVID? You probably answered that, but it has come up again.
No, it's a great question. And again, for the reasons we outlined, which I'll mention again, you can get COVID more than once. This is a nuance with this particular virus. We don't know exactly why it happens. We know that the antibodies that our body produces, the soldiers that our body produces to protect us once the COVID has entered our body, they do pop up, but the soldiers don't stay long. The whole reason we get vaccinated, as you know, against measles, mumps, rubella, the reason we get all these vaccines as young people is because once you get vaccinated with these things, the chickenpox vaccine, our body antibodies, soldiers that stay in our body for life, and they protect us for life. Well, guess what? With COVID, that doesn't happen. We get infected, the antibodies pop up, and then within 6 months, they disappear. So just having COVID previously does not protect you against COVID in the future. And so we need to stay safe. We need to stay vaxxed up and protected so that not only do you not get super sick if and when you get exposed to COVID, but more importantly, you don't pass it on to your kids, or you don't pass it on to your parents, or you don't pass it on to the people you work with, when you get sick. And so this is one of the reasons why we emphasize that it's important to make sure that you stay protected, regardless of your previous vaccination history or regardless of your previous COVID infection history. It doesn't matter. We all are here at the same point. We all need to stay updated.
Okay, that's excellent, and that's good information. Dr. Camino, what is the difference between the flu vax and ammonia vax?
I think pneumonia vax. Yeah, I think most people, when they say pneumonia vax, I think they're referring to the pneumovax. And again, as we discussed, the pneumovax is typically the vaccine against bacterial pneumonia caused by strep pneumonia.
Pneumonia vax.
Where flu vax is basically geared against the virus influenza. But, since you mentioned that, if I may, just go back to COVID, one important thing that people should also know, we're talking about vaccines, which is for prevention. However, for many of us, including those who are vaccinated, if you do come down with COVID and you are sick and you do a home test and it is positive for COVID, what do, right? Well, if you are not at a point where you are so short of breath that you need to go to the hospital, you need to call 911, but you know that you have bad asthma and you don't want the infection to get worse because you have asthma, then you have 5 days. You have 5 days from the day you were diagnosed with COVID to reach out to your healthcare provider and tell them, hey, I just did a home test. I'm not feeling well. I tested positive for COVID. What can I do? Most healthcare providers now know to prescribe the antiviral medication called Paxlovid. And I want to make sure that everyone is aware of it, because you need a prescription from a healthcare provider to get it, right? So Paxlovid is basically an antiviral medication for COVID. You have Tamiflu for the flu. So for COVID, you got Paxlovid. And it's basically 3 pills you take in the morning, 3 pills you take in the evening, and you do that every day for 5 days. And that medication has been shown to help reduce the chances of you ending up in the hospital, where, again, if you end up getting admitted in the hospital with COVID, you're going to see me. And then when you see me, I got to put oxygen on you. I got to put you on a different IV medicine, and we got to watch you closely. So for many of us, if you're not to the point where you need to go to the hospital, but you have COVID, because everyone is, we're getting better at doing those home tests. If you test positive, then you have an option of calling up your healthcare provider and saying, hey, I need that Paxlovid. Can you please prescribe the Paxlovid? So please pass the Pax. That's what we say. All right? So it's a medication that can be given to everyone over the age of 12. All right? And it is safe. There are some interactions with some heart medicines that the pharmacy and your doctor just need to clarify. But for the most part, the medication is safe, and it's only 5 days. And so I just want to make sure that everyone is familiar with the name of that drug. It's called Paxlovid.
Paxlovid. Thank you so much. And ladies and gentlemen, I want to thank you all for signing up to participate in the Urban League of Palm Beach County's COVID/flu telephone town hall meeting. Of course, we're so proud to partner with T. Leroy Jefferson Medical Society. Dr. Camino, thank you for all of the information that you have provided to our callers. I hope that this has been helpful to you. I also really want to thank our screeners. I'd like to thank GotVax for helping the Urban League to really organize this town hall telephone meeting. And we hope that you will, please, callers, look for messages in the future regarding COVID and flu vaccinations. Thank you to the National Urban League, and we hope to conduct another telephone town hall meeting really soon. So thank you all. Again, Dr. Camino, you were fabulous, and we thank you for all of the information that you provided. Any last comments?
Just to remind everyone to stay vaxxed up. It's important.
Okay, well, you know what? Before we end, this seems to be one final question. This is from Marion from West Palm Beach. How accurate are the home COVID tests, especially since we've been having them for a while, and if we get the new ones, this will be our final question from our callers.
Great question. Yes, the home tests are accurate, especially if you're talking about the ones that you are purchasing from the local pharmacies. We didn't get a chance to get into talk about testing too much, but most of the home tests will tell you if you have an active infection, and that's the most important thing. It's called antigen testing, and so they are very good. The Novavax and all the others at detecting active infection. So to the person who asked this question, which is a very important point, so thank you for bringing it up. If you suspect you have COVID, because let's say, you went by your auntie's house, and then auntie calls you a day later and says, oh, guess what? I just tested and I came down with COVID. Now you are worried. Now you are worried that you have COVID because you spent all day at auntie's house for Thanksgiving. So you are going to, in many instances, you're going to rush out and get yourself a rapid COVID test. You do the test, and it comes back negative. but you spent all day long with Auntie on Thanksgiving. The idea is you should repeat the test because the test is so accurate. This is my point. The test is so accurate that it records active infection. So it doesn't mean you don't have COVID hiding inside of you. It just means that it hasn't got to the point where there's enough COVID in you to test positive that you actually have it, if that makes sense. So the idea is if you have a strong suspicion that you have COVID or you think you've been exposed to someone with COVID, you want to wait at least 48 hours, right? 48 hours to do the home test, because those home tests are not going to pick up a super early infection or a super early exposure. You want to wait at least 48 hours from when you left Auntie's house to do the test. And then if you really were exposed, that test will most likely, 90% of the time plus, will be positive, right? And of course, if you're having symptoms, regardless of who you're around at Thanksgiving, if you're like you wake up and all of a sudden you feel feverish and you have a sore throat, just go get that COVID test, right? So the more symptomatic you are, the more likely that test is going to be positive. So good point. Definitely use the test. I would say if you have a test that is more than 6 months beyond its expiration date, you can throw that test out and get a new one. That's another question we get a lot. How long can those COVID tests sit in my cupboard? If you look at the expiration date and it's more than 6 months, that usually means it's not going to be a reliable test, and you should probably get a new one. But great questions.
Okay, then. Well, ladies and gentlemen, we are out of time. And so, again, we thank you for signing on to participate in the Urban League of Palm Beach County's COVID and Flu Telephone Town Hall meeting. Again, thank you, Dr. Katongo Camino. We appreciate your time and all your information. If you have more questions, and I know we weren't able to get to all of the questions, please just leave a voicemail after the town hall ends on the number that you dialed. So thank you, and we look forward to doing another town hall meeting. Everyone have a good evening.
Thank you.